And actually, Jason, you're on screen, and so that's very handy. This first question I have is from Willie. Could you please expand and clarify how seniors over 80 will book their appointments for vaccination? I think I heard that they will be notified. How and by whom?
So this is the crux of the how do you get access to the vaccine?
Yes.
If you are over 80. So there's a couple of things. If you're in East Toronto and you have a family doctor in East Toronto, one of the things we're rolling out is over 80 clinics in primary care settings. So one way is through your family doctor. The other way that's going to come out in there, I saw in the flow of questions, when is this provincial online place to register going to go live? And what we understand is it will be the week of March 15th, today being the first day of March. So in 2 weeks, there will be a provincial online portal where you can self-register for access to vaccine. And we understand that you should be able to access that week. So that's 2 weeks from today, basically. Having said that, we don't have this up and ready yet. In East Toronto, we may, and we're exploring this right now, create something before then where you can let us know that you want on that list. And we will potentially, with also a place to call in, potentially, and see if we can do that before the 15th. We're not sure yet if we'll be able to lift that up locally, but we are exploring that as an option right now. And if we do, we will blast out to the community very loudly that that's available. So we'll do that through the offices of Peter and Rima. We'll share out our East Toronto Health Partners website news link. And you can check that every day and it will tell you, okay, there's now a way to do this in the next 2 weeks if we are able to do something before then. We haven't yet, we will, if we do that, we will transition to the provincial online booking system when it's available. And that's 2 weeks from now. And in terms of East Toronto, because I know part of the question is the numbers seem low, like why is it so slow? Is it about the accessibility of vaccine? So some of it's about supply of vaccine and some of it's about making sure we're doing this in a sustainable way. You'll remember we went really fast at the beginning and then ran out of vaccine. And that didn't work out so well either. So it's a little bit of striking the right balance. Having said that, we anticipate if vaccine keeps coming in that locally, our plans are for through March to be able to do about 5,000 a day, and by April up to 10,000 a day locally. That's what we're aiming for. So that will have to be based on being able to receive enough vaccine to do that, and to get enough people set up in a way to do those mass vaccine clinics. The only way to do that large number is some of those very, very big clinics that I described. The outreach, we'll continue to do outreach alongside that, but it doesn't let us lift up the same volume, but it allows us to be more specific about reaching people. So I hope that answers that question.